Hello, my name is Jinhee Kim, and today I'm here to talk about urban health paradigms, along with my co-presenters, Christina Un and Alana Krimi. In this presentation, we will first start with an introduction of the multidisciplinary field of urban health and why understanding paradigms is important. Then, we will discuss the criteria that we use to identify the paradigms and present the resulting 4 urban health paradigms. Urban health is complex and diverse, and with this, many disciplines and sectors participate in the research and practice of urban health. This diversity of backgrounds invites multiple theoretical and methodological views on urban health. These views, or paradigms, are reflected in the language and terminologies researchers and actors use. More importantly, different paradigms shape the underlying beliefs about which urban health problems are important and worth addressing, and their appropriate and preferred solutions.
Recognizing urban health paradigms is essential in 2 key areas to promote urban health: facilitating transdisciplinary research and influencing the policy process. First, each discipline interprets urban health issues differently and focuses on specific characteristics of urban health. They produce evidence and data that stem from different foundations. Therefore, understanding the views of different urban health paradigms allows us to reinterpret the information and creates opportunities to develop transdisciplinary research programs. Secondly, paradigms are the foundations for ideas and beliefs that are central in policymaking. Policymaking is a process of conflict and negotiation over policy ideas. Having a clear understanding of existing urban health paradigms can help policy actors frame their ideas within the language and worldviews of different paradigms.
A paradigm is a specific set of views among members on how urban health issues are to be understood. In our categorization, we use the following 4 key criteria to distinguish paradigms. Firstly, the conceptual gaze on which urban health issues are considered more important. Secondly, theoretical frameworks on what causes these urban health issues. Thirdly, methodologies on which data collection or analytical method would best measure and seek information. And lastly, the instrumental dimensions on which solutions effectively resolve the prioritized issues.
Based on these 4 criteria, we have identified 4 distinctive urban health paradigms. They are medical industrial city, urban health science, healthy built environments, and health social movement. The medical industrial city paradigm is driven by business, industry, and the government, generally by the healthcare, construction, and technology sectors, where healthcare infrastructure and services are treated as commodities to be invested in for urban change. The concept of health is viewed in a biomedical, individualistic, pathogenic model and coupled with the image of economic prosperity in the form of livability and healthy lifestyles. Actors in this paradigm include place entrepreneurs, businesses and industries that profit from such development, politicians, universities, media, and corporate capitalists. This view is less active in scientific research, but often is the dominant position in current urban development practices, such as large-scale healthcare industry and infrastructure-centered urban development or smart city initiatives for health.
The urban health science paradigm emphasizes epidemiological and classic Cartesian methodologies to empirically analyze the complex causal associations between the urban environment and health. The urban environment is viewed as a critical layer in the multi-level framework of the social determinants of health, and the urban health system is a complex network of multi-directional causal relationships, feedback loops, and unintended consequences. Evidence is generally produced through measurement. Quantification of the urban condition and its health impacts is critical when developing solutions to improve health. Therefore, recommended solutions are generally technocratic and usually propose lists of evidence-based interventions or best buys.
The healthy built environment paradigm sets the reintegration of health as a main objective for spatial planning. Ideas in this paradigm focus on transforming the sets of procedures, institutions, and regulations of the urban planning system. Researchers and policy actors following this paradigm develop and propose codes or guidelines as criteria or benchmark for urban planning projects to ensure health is considered in the projects. Rigorous, quantitative methods are regarded as high-quality evidence, but proponents of this paradigm also advocate for more participatory and comprehensive methods to understand the complexity of the issues.
The health social movement paradigm supports a value-based approach to health promotion. It values principles such as health equity and empowerment in identifying and solving urban health issues. Views of this paradigm align with the definition and principles of health promotion as outlined in the Ottawa Charter for Health Promotion. Ideally driven by the empowered community, solutions focus both within in community-driven action and outward in mobilizing for policy and systems change. A healthy city is not defined by a set of standards. It is one that commits to the healthy city's values and to continuously creating supportive environments for health. The WHO Healthy Cities movement is an example of the principles in this paradigm.
We believe that without recognizing the underlying foundational beliefs that form different positions in addressing urban issues, our responses will remain fragmented, or collaboration efforts will be at best superficial. The reality is that we all embrace different configurations of these four paradigms. The four paradigms are neither mutually exclusive, nor does only one paradigm appear in individual urban health research or policy. It is also not expected for individual studies or researchers to be designated to a particular paradigm. Instead, identifying paradigms supports researchers, practitioners, and policymakers to better understand the diversity and complexity of urban health issues. More importantly, recognizing other viewpoints enables us to identify areas that facilitate transdisciplinary collaboration. We'd be interested in hearing from you about your response to the four urban health paradigms. Please contact us if you'd like to engage in further discussions. Thank you.